Hey, this is Jeremy, and today we're going to be talking about consent. Now, consent, that is the agreement, or giving somebody permission to do something to you, or an agreement for you to do something for them. And that's going to be the kind of definition of consent that we're going to be working off of. This is important to understand, especially as we're understanding how the different types of consent work towards our patient's care, and with what we can and cannot do to them. Now, in medicine, to consent to something, you have to have a decision-making capacity, and that's essentially the ability for you to be able to make medical decisions for yourself. There's a couple circumstances where somebody loses their ability to make, they lose that decision-making capacity, and especially if somebody is suicidal. They are not necessarily going to be able to make the best decisions for themselves. If you have somebody who is hypoglycemic, so they can be profoundly altered, that they lose their decision-making capacity. And so kind of a standard that people use to gauge that decision-making capacity is, do they have any suicidal ideations? If not, then we are going to operate under the assumption that they do have their best interest in mind. And then are they alert to person, place, time, and event? Now, that's something that you have to kind of look at on a case-by-case basis, because, for example, if you go to somebody's house, and let's say it's an 85-year-old woman, and one of your questions that you ask everybody is, what day of the week is it? Or who's the president? Well, she's 85 years old. She may not ever leave her house. She may have her groceries delivered, and she may know that Jeopardy comes on TV every day at 1 o'clock. But that doesn't necessarily mean that she knows what day of the week it is. That doesn't necessarily mean that she knows who the president is. That does not necessarily mean a lot of those things that we would assume for people who are in today's societal norm. And so that's important to understand. You have to look at it a case-by-case basis. And so adjust your questions appropriately whenever you're deciding, does somebody have that decision-making capacity? Now, there's two big types of consent that we need to know, and that's informed consent, and there's also implied consent. Informed consent, that is the patient consenting to your treatment or to transport after explaining the risk and the benefits of all the proposed treatments that you're planning to offer. Now, if you say, hey, we're going to go ahead and we're going to get a blood pressure over here in this arm, we're going to hook you up to the monitor, get a good look at your heart, and I'd like to get an IV over there in your left arm. Well, your patient has a right to consent to all care or none of it. Or they can pick what pieces of the care that you're wanting to provide that they get to consent to, especially if they have that decision-making capacity. So if I have somebody that says, I'm okay with you hooking me up to the monitor, and I'm also okay with you getting my blood pressure, but I'm not okay with you getting me an IV. I would rather wait till we get to the hospital. That is completely appropriate because they decide who they get to do what to their body. And that IV, that is an invasive procedure. And, maybe they've been burned out by a couple bad experiences by somebody in the pre-hospital setting, or maybe they've been burned out by people in the hospital setting. It's a case-by-case basis. And remember that your patient can consent to all care, none of your care, or some of the care that you plan to provide. Now, you also have implied consent. So implied consent, that is going to be that for unconscious adults or adults who are too ill or gravely injured to be able to think for themselves, they've lost that decision-making capacity. So if you have somebody who's unconscious, unresponsive on the side of the road, we are going to be operating under implied consent that somebody under a normal circumstances, that patient would want life-saving treatment and transport delivered to them to potentially save their life. And we are essentially acting in the best interest of the patient. Now, this doesn't mean that we're going to get 14-gauge EJs on somebody just because they're unconscious, unresponsive, and we're suspecting they might be a little drunk. Because an EJ, that's invasive. So you do have to kind of, again, tailor your care and how you're using this on a case-by-case basis. Now, we also have involuntary consent. This is going to refer to situations whenever a law enforcement officer or a legal guardian grants you permission to treat somebody that may not necessarily be able to consent for themselves. Now, so this includes somebody who may be in police custody and they're wanting them to get looked at, and the patient that the police has in custody, they're like, I don't want you to treat me. I don't want anything. I don't want anything to do with you. I don't want you to get my blood pressure. I don't want you to check my blood sugar. I don't want anything that you got. Well, just because they are in custody does not mean they lose those basic human rights. So you do have to kind of be able to talk with them and get them involved in it, and try to see if you can get them to allow you to at least do something to kind of maybe appease the situation. And especially if you have a child. So if you have a child that doesn't want you to assess them, but the mom or dad says that they want you to assess them, you have to kind of do what you can to kind of get that patient on board with you doing your assessment. That way they can, A, they can get on with their day, or B, we can get them to the right place to deliver them the treatment that they need. And if the officer is adamant, that officer or parent is adamant about you treating, you may need to consult medical control, and that can be your medical director or what other program it is that you have set up at your local place of employment. Now, we also need to worry about minors when it comes to consent. If you're under the age of 18, technically you cannot consent under normal circumstances. There are two big circumstances where they can, and that's whenever they're emancipated and pregnant. Now, whenever you become pregnant, you've also become emancipated because you're looked at as an adult in that case. Now, if you have somebody who's emancipated, they're going to have paperwork, and that paperwork may vary from state to state or situation to situation. But if you go up to somebody and they're like, "Yes, I'm 16," and they're like, "Okay, well, I'm sorry, your parents aren't here, so can we contact them?" "No, we can't." "Well, we're going to need to transport you because you're not allowed to refuse care, and because you're a minor." He says, "Well, I'm emancipated." Then he has to provide legal documentation that he is going to carry with him in the case that he is actually emancipated. If he cannot produce that paperwork, we are going to be operating under that involuntary consent for the minors, because he cannot refuse care if he cannot provide documentation that he's emancipated. Now, this also applies if somebody is in the military. They will be able to provide a military identification, especially if they're 16, 17 years old. 17 is going to be the typical age that you're going to see in these current times. And whenever you have somebody who's pregnant, they are allowed to refuse care. Now, whenever you have somebody who is an underage mother, so for example, if you have somebody who's 16 years old and they have a 2-year-old daughter, well, if the neighbor is the one that called EMS because they wanted a welfare check done, and because they think that the child might be sick, and you show up to the house and the 16-year-old mother does not want you to assess her child, she has every right for you not to assess her child, because that child is hers and it's her responsibility. All right? So even though she cannot necessarily consent or refuse to care herself, she can consent or refuse to care for her daughter. And so that is important as well. Now, you always need to document accordingly, and you need to say if this way, because refusals is a big one where people that is one of the most commonly litigated areas of EMS as far as the calls that we run. Now, if you have somebody that you do obtain a refusal on, well, were they able to make those medical decisions for themselves? And if they were not, then how did you dictate that they had that decision making capability for themselves? And so you need to document that person was alert to person, place, time, and event. And if you're in that situation of that 85-year-old grandmother who may not necessarily have a normal baseline, what you and I would expect, she was alert to herself and her current surroundings. And so those are all things that we need to consider, and those are the really big topics when it comes to consent.